Now, what we're not told in this paper is how many of these patients actually had COVID. We're not told whether, if these patients had COVID, that was related to variability within the cohort. These are just average figures, we assume. These are just average figures for the cohort. So there's a lot of things it doesn't tell us. I'd really like to know if the patients that had COVID had higher levels of these inflammatory markers or not, but we're simply not told that. We don't know. We wait for the full paper. We assume a full paper's coming. We don't know yet. Now, these changes resulted in an increase of the plus score. So in their group, the average risk of having an acute coronary syndrome in the next 5 years was 11%. And this went up to 25% risk. So instead of having 11% risk of having an acute coronary syndrome in the next 5 years, that went up to 25% risk. Now, again, we don't know much about the group, but that increase from 11% to 25% is, of course, totally massive. Absolutely massive. If this were to be applicable to the entire population, this would basically mean we're going to get an unimaginable amount of extra heart attacks. That's what that would mean. We don't know about the time frame, of course. At the time of this report, these changes persist for at least 2.5 months post the second VAC dose. So, okay, we know they persist for 2.5 months. So does this risk only increase for 2.5 months, or does the increase for longer? We don't know. Well, what we can say is this increased risk from 11% up to 25% risk over 5 years, only according to this paper, seems to last for 2.5 months. Does it last for longer? We don't know. That's all we're told. We conclude that the mRNA vax, and again, the way this is written is direct from the paper, which I must say I do find a little bit, I wouldn't say casual, but it's not quite the way I would have written it. But this is exactly from the abstract. 2.5 months of the vac. Yeah. Okay. Yeah. It's obvious they mean vaccine, but that's the way it's written in this abstract. We conclude that the mRNA vaccines dramatically increase inflammation of the endothelium and T cell infiltration into the cardiac muscle. So in other words, they're saying that you do get increased inflammation here and increased T cells into here, some of which may be T cytotoxic cells, which most certainly have the potential to kill cardiac cells. They certainly have that potential. The abstract says, and may account for the observation of increased thrombosis, that's the blood clots. That makes sense because of the increased inflammation. Cardiomyopathy, that makes sense of the apoptosis and destruction of cardiac myocytes, the cardiac muscle cells, by T cytotoxic cells, and other vascular events following vaccination. It does make sense. And I would add further that if there's a higher dose of the vaccine going to the myocardium due to inadvertent intravascular administration, this rate would be dramatically increased.